Hi, this is Dr. Corey Maas on Looking Your Best, and we're answering questions today about lines and wrinkles, and how we define them is really important because different lines and different creases or wrinkles deserve different treatments or have best options for treatment. We've talked previously about the treatments that we offer for fine little wrinkles and lines that occur on the face with age and with squinting or smiling, the radial lines around the lips. There are other types of lines that I call transition lines, like the smile line between the fold of right at the fold here between the nose corner and the mouth, or the marionette lines as they're often referred to from the corner of mouth to jawline. These areas represent transitions where the soft tissues are sinking slowly downward with gravity and toward the middle of the face, and once they get to the upper and lower lip, they can't transition any further. The fat and soft tissues can't sink any further because they hit a hard platform where the skin of the lip is very closely attached to the underlying muscle, and so the tissue builds up there. When we're doing such lines, what we're really doing with fillers is softening the transition between the cheek and the lip so that it's not such a steep curvature, or between the lower part of the cheek and the lower lip so that it's not creating a crease or a frown line or an upside down smile in many cases. And when we're doing these treatments, again, there's a variety of treatments that are available. If we go outside of the area of lifting, surgical lifting, all of which really can benefit people for the long term. Things like a mini facelift can do a nice job on this. The non-surgical facelift, which often is therapy, is the main technology around non-surgical lifting. There are certain types of suture lifts that can do a lift of the mid-face or the lower face, like the silhouette lift, or what we call the Perk mid-face lift. And so all those lifting techniques are more surgical. And when we get into things that are office-based procedures that are really come and go types of procedures, really simple and straightforward, we're talking typically about different types of fillers. And almost all of the fillers from the three families of fillers, that's the Restylane family, the Juvederm family, and the Belotero family, can do an effective job of lifting the fold or crease and softening the transition so it's not so steep again between the fold and the lip, or between the lower cheek and lip. There are certainly special techniques for doing this, and there are certainly preferences we have, and as more and more fillers come out, I'll tell you that those technologies change. For example, we were part of the Juvederm Velour and Volift studies that looked at the nasolabial fold, and those by far seem to have the longest duration of effect, up to 18 months in some patients. The standards that we started with were Restylane Lift or Restylane, and of course Juvederm, even the Juvederm XC product, which holds a lot of water, and that can be a benefit here, a lot of body water, so it absorbs body water, and in this area that can be a benefit because it softens the transition naturally. The same thing can be said for Belotero, which holds less body water, but all of them are doing the same thing. They're really lifting this transition so it's not so steep, or softening the transition in the area of the corner of the mouth where there's a big drop off so that we don't see these deep shadows or lines that are created in the marionette line and the folds. There's other fold areas too, the jawline and certain transition zones where we treat with specific products, and we'll talk about those, including the tear trough and the orbital malar groove, or the hollows around the eyes. And we do that based on the specific characteristics, mainly the water holding capacity of these HA or hyaluronan fillers, which are still now growing, but about 95% of the fillers used are in these categories. Stimulatory fillers like Radiesse and Sculptra can be used. I sort of take Sculptra off the table in this case because it's typically for volume only, but many studies have been done with Radiesse in the nasolabial fold, which is an alternative. I would just say that our go-to products in this situation are the hyaluronan fillers, and we're looking at some of those longer lasting ones that I mentioned to you earlier, the Restylane Lift, the Velour product, and ultimately we're looking at products that are durable, long-lasting, but also reversible with one of the enzymes like Vitrase or Amphidase or Hylenex, one of the enzymes that can adjust them if we don't like the outcome. So those are specific areas. I call them the transition areas. And when we look at fillers in general, there are three main categories. There's sort of volume restoration, the temple area, the cheek area, where we lose a lot of volume, sometimes along the jawline. There are softening transitions, typically between the cheek and the lower face. Those areas are transition zones. We want to soften the transition zones. And then there's the fine line treatments that we talked about, the perioral lines, the little creases around the eyes, forehead, and brow, really anywhere on the face, that we're really trying to address just the dermis in those situations. So if you have any other questions about sort of strategies with soft tissue fillers in general, mini lifting, the suture lifting techniques we talked about, or any areas where we're talking about softening the lines that go along with gravity and facial aging, please don't hesitate to call or write drmaas.com. You can send a picture or video, and we're always happy to answer specific questions, either publicly or privately. As always, it's my pleasure. This is Dr. Maas on Looking Your Best.